And now for the sputum specimen collection. Definition is a sample of material expelled from the respiratory passages taken for laboratory analysis to determine the presence of pathogens. The purpose is to obtain for culture to identify the microorganisms responsible for lung infections and identify cancer cells shed by lungs tumors. The equipment that we're going to use is the sputum cup with cover and PPE as indicated if needed. Considerations before, during, and after the procedure. Put on gloves, perform hand washing, explain procedure to the patient. Patients should be advised to not clean their teeth. And things to document after the procedure is document the procedure done and record the color, amount, and consistency of the sputum collected. So now let's proceed to the procedure. First, check the doctor's order to avoid error that may have occurred. So, urine. And now, explain the procedure to the patient. So, ma'am, I am Siti Bashma. And I'm going to get a sputum of yours. So is it okay with you? Optimal results are achieved when the patient is given pre-treatment instructions. And next, gather necessary equipment to save time and effort. So here is the equipment. Now do hand washing. Do hand washing and don on clean gloves to prevent spread of microorganisms.
Hindi manong dito si Bashma sa manok. Uy, tingin ka pa sa video. Paski doon mo.
Ang gumita nga buong. Speak and mute. Ang yung.
So, place the patient in semi-polar position. It allows maximum chest expansion in clients who are confined to bed, particularly those dyspnea. So, I know. And now, let the patient rinse mouth with water to avoid contaminating the sample with the food residue. So, pag-rinse ka sa And now, instruct patient to do 3 abdominal breathing, then directed cough to provide comfort to the patient. So, ma'am, breathe into using your abdomen times and directed cough. Okay. And cough. Okay. If the patient did not produce any sputum, repeat abdominal breathing and directed coughing. So, since the patient already produced a sputum, so we're going to collect it. So,
Didn't feel like a
abdominal breathing and coughing help in removing secretion from airway trough. Instruct patient to expectorate only the sputum in the
siwa na lagi ka instruct pituro ka na so instruct the client so 3 abdominal na if hindi siya makakuha na purumanan. Tapos lagi na instruct the client to expectorate na kung buhos ka na ipa-perform sa ma'am kailangan mag para may say siya.
Do you feel anything?
Okay. After the patient rinse her mouth, instruct patient to do 3 abdominal breathing, then directed cough to provide comfort to the patient. If the patient did not produce any sputum, repeat abdominal breathing and directed cough. The abdominal breathing and coughing help in removing secretions from airway trough. And instruct patient to expectorate only the sputum in the specimen container. Let's instruct the patient to breathe using her abdomen in 3 times. So, ma'am, breathe in using your abdomen in 3 times. And direct out. So, after expectorate the sputum, the sample contaminated with oropharyngeal secretion and saliva are difficult to interpret and can be misleading. So, since we get the sputum and already place it into the container, offer oral hygiene and place patient in a comfortable position to maximize this patient comfort. So, after natin kunin yung sputum, let's offer a oral hygiene to the patient. And then remove gloves and do hand washing to prevent spread of microorganisms. Next is to label specimen container with patient's name, age, date, and the number of collected specimen. Send container together with the request to the laboratory to avoid confusion and exchanging specimen for baseline data. That will be all. Thank you.